Hi, it's Amber Paulus from the ANNA Research Committee. We are bringing to you 5 modules for research development. This is Module 1, Getting Started with Research Development. So the intention of these research modules are to be a 5-part research series developed by the 2020 ANNA Research Committee. This particular module describes methods for identifying research questions, aims, and hypotheses. More information can be found at the link below to look at the grants and awards that ANNA offers that these modules might help in development. The objectives of this first module is to define the research problem and justifying research inquiry. Then we'll talk about describing the components of a literature review, describe how to develop research questions and testable hypotheses, and then finally identify how hypotheses lead to research aims. So the first thing in developing a research program is identifying what the problem is. A problem is the main organizing principle that we're going to analyze. It guides the work that we do as researchers. The problem provides a way that we focus, and it governs what we want to say. What is it that we're trying to learn, and how do we want to communicate that to others? So it's meant to represent the core subject matter of scholarly communication, whether it be presentations like this or writing for manuscripts that are going to be published in a journal. It also is a means by which we arrive at other topics of conversations and the discovery of new knowledge and understanding. So when we say that we're developing our research program or trajectory, typically we get there by creating a series of problems that we investigate. So the first section we'll talk about is selecting and justifying a research problem. Research justification is often the goal of the first step of the research proposal. So when we're writing a research study or proposal, we're proposing what it is that we want to investigate. You want to get your audience attention and demonstrate why your research matters. Of course, it's going to matter to you, it's of interest to you, but you have to construct it in such a way that it's going to be interesting to other people or funders if you're writing for a particular grant. Like the ANNA grant. You also want to make evaluators, people who are going to read what you're proposing to do, want to know more about why your research is compelling. So a compelling opener statement. We always describe this as if you're going to see a movie and you watch the trailer, it's the trailer that makes you want to go see the movie. So it's the same kind of idea. So the first step is the justification. Sometimes this is called the statement of the problem. It involves providing the reader with critical background or some kind of contextual information. So if you're a nephrology nurse and you've always worked in nephrology, it makes a lot of sense to you. You understand all facets of being a nephrology nurse. But someone who's evaluating that might not be a nephrology nurse. They may work for the agency at which you're seeking funding from. So you have to explain it in such a way and provide enough contextual information that introduces the topic area and why the research is important to someone who might not know a lot about that topic. And the research proposals are often, they often open by outlining a central concern, issue, question, or conundrum that the research, what you're going to investigate, relates to. So if you're trying to figure out what a problem would be to investigate, I often say, look at your clinical practice, if you're a nephrology nurse, and examine things that you find difficult or challenging or even frustrating, like ways to improve it, to make it better. The frontline nurses always have the best ideas because you're out there working in the field on the day-to-day basis and identifying problems in an ongoing fashion. So, but once you identify what that problem is, you want to think about, why is this important? What real life or everyday problem, question or context does this research relate to? So are there other areas, other clinical practice settings maybe that perhaps have that same experience, but maybe some of the contextual factors are really only relevant to nephrology? Like, for example, most dialysis provided in the outpatient setting. Are there other outpatient practices who might experience those same things that you could relate to? Maybe they've studied it. Nursing home care is another great setting that you can look to see if it's been researched. Like if you wanted to research staffing, is there enough staff? There's been a lot of research done in the hospital setting and in the nursing home setting that you could look to make some connections to. See how they've built their research programs in those areas. What is the research ultimately trying to achieve? How can I grab the reader's attention and concern? Like we talked about, you create the movie trailer for your research study. How can I state the problem or context of the research in terms that most people can relate to? So again, not everybody will be a nephrology nurse who's evaluating your research proposal. So making it have enough information so they can truly understand from an outside perspective. What possible negative repercussions is there for not solving this problem? So if this were to continue and go on and on and on, could patients be impacted by that? Would the staff be impacted by that? And what benefit does the research promise? So how is it going to change the way we practice for the better? Establishing legitimacy of a research justification. So the way that you do this is you look to see what has been done. So like I was saying, you can look in other practice settings to see if there's been research on that specific topic, and then start creating a reference list. You can also refer to a policy, press report, or other reputable information source. So right now we know that since July 2019, when President Donald Trump put the Advancing American Kidney Health Executive Order in place, there's been a lot of talk about modalities. So if you wanted to research utilization of home dialysis modalities in the United States, you could refer to the Advancing American Kidney Health policy as something to justify why that is so important. You also might look for things by other agencies like the CDC, the Center for Disease Control and Prevention. If you were going to investigate how to reduce bloodstream infections, they have annual reports that they produce. You can also look for annual reports from other agencies that might align with your research topic. Provide a detailed outline of a context, condition, concern, conundrum, or situation. So before you get into the like nitty-gritty pieces of research development, sometimes just a brief outline will help you get all of your thoughts on paper, and then from there you can start to build something a little bit denser. And then provide an antecedent or evidence from personal experience. So we call this anecdotal evidence. And this is how you, like when you're in practice and the things that you experience makes it anecdotal. It's your experience, or maybe it's your colleague's experience, your patient's experience. And so there is research, like qualitative research can collect those kinds of things and turn it into something. But also it can just be the primer that's going to lead you to a more specific research study. So next, talking about the literature review. So like I said, some of the justification is finding literature that supports your premise for research or why you want to research that particular topic. But the actual literature review is more holistic, and since it's a survey of scholarly resources that provide an overview of a particular topic. It's often a collection of the most relevant and significant publications regarding that topic in order to provide a comprehensive look at what has been said on the topic and by whom. So we usually say go back 5 years, but sometimes if there's a meta-analysis or a review of the literature that has been published before, if it's a bit older, that's okay. It's still relevant. It perhaps is the most relevant because it has actually surveyed, it's reviewed the literature for a period of time and provided the best evidence from that time period. So the basic components of a literature review is a description of the publication, what was it about, a summary of the publication's main points, what did they find, and a discussion of gaps in research. Oftentimes, when you're reading the background or introduction of a publication, they will tell you why they aim to do that research. So what was the gap they were trying to fill? Almost every research study, so not just like publications about a specific topic, but actual research that's being conducted and the intervention is being provided, they will say what the gap was at that time. And then often in the discussion, they will readdress that there might still be gaps. Like if it's a descriptive study and it's just meant to kind of look at a problem and be hypothesis generating, the researcher will put in the discussion or the conclusion where they think the research should go next. And so you can often look there to say, does this align with like what I'm trying to study? And that might help you find a gap. And evaluation of the publication's contribution to the topic. So once you start to get a reference list really going, you can start to see how, when they sum all together, what is that body of literature contributing to your specific topic. So what is the purpose of a literature review? Well, it's to provide a review of writings on a given topic in order to establish the reviewer's own position in the existing field of scholarship on that topic. So if I was going to evaluate staffing in the nephrology setting, I would look to see all that has been published on staffing, not just specifically to nephrology, but probably across healthcare in total, inpatient setting, outpatient setting, nursing home setting, maybe ambulatory care, some other, there's outpatient surgery now, to try and look at how they have approached staffing, because I'm trying to put myself in that field of scholarship. I want to be the person you think of when you're looking at staffing in the nephrology space. So it's going to help you figure out where your study can fit. A literature review also provides the reader with a comprehensive look at previous discussions prior to the one the reviewer will be making in your own research publication. So if I wanted to do staffing again, just using it as an ongoing theme, I could look to see Dr. Thomas Hawkins has researched staffing from workload perspective, so I could see what she had written about and what she found around staffing and how miscare happens often because there's just not enough nurses to do the work. And so I'm going to look back to see if what I'm going to do in my study is going to carry on that kind of research legacy. So in short, the literature review shows readers where the reviewer is entering the academic conversation on a particular topic in the context of existing scholarship. So when you're creating a literature review, you want to first define your goal. What is the actual topic that you're going to research, and what is it that you want to know about it? Then you do your research, meaning you go and you find all of the articles that relate to that topic. You want to ground your summary in relevance. So I wouldn't just research something so payment is another thing that we talk about a lot, but we know that the majority of dialysis patients are covered by Medicare because in 1972, ESRD became a covered, almost like universal healthcare essentially. And so while we might talk about innovative payment models, meaning we're going to try and incentivize a certain quality of care, we might not just talk about coverage. Like, is that really relevant today? Meaning that, are there patients out there with no insurance? Perhaps in the CKD spectrum, chronic kidney disease spectrum, before they hit end-stage renal disease, for sure. We know that probably happens. But if we're just talking about ESRD, it might not be relevant just to talk about payment. And then develop your review logically, meaning that you have to have like some process as to how you're going to synthesize the literature. And I often say, like, do it sequentially in time. So if you're looking longitudinally over time, maybe the last 5 years, and then including some of those meta-analysis that review, large periods of time of literature, you want to kind of go across it. You want to take someone on a journey through what has been done and then what you're going to do. And then obviously start building out your reference list in the form or fashion that you're going to intend to publish it. Most nursing journals use APA, but then if you go deeper on the medical side or more generic that aren't specific to a role like nurse, AMA is another publication or citation source. So creating a literature review, step one, you're going to define your goals. So just going a little bit more specific, if you're writing an argument paper, you create the thesis statement with a clear position. If you're evaluating scientific theories, you develop a hypothesis to examine. If you're providing a self-contained review of publications like meta-analysis, you're going to state your project's purpose, that you're going to synthesize all the recent literature between, two benchmarks, 2 periods of time, 2000 to 2010, just for example, and state your project's purpose. And then at the beginning of any manuscript, you're going to define your paper's purpose so that the literature review will be anchored to a specific point of view. Then you're going to do your research. You're going to review a number of texts or manuscripts that most closely pertain to your topic and position, that they are well written by relevant scholars, and then you understand who the top voices are in your topic's academic field. So you want to know who's really researched that, not just if they've done one study. I mean, if they're early in their science and their research program, they may have only done one study, but they often have published about that topic across different mediums. Like it might have been in a podium presentation or a poster presentation, maybe not just academic articles in journals, but be sure to include the most pertinent publications by those scholars. Then you're going to ground your summary in relevance. As you summarize each publication, provide the context for that publication's importance by tying its main points to your thesis, hypothesis, or project statement. How does it relate? And then establish its relevance to the discussion. So what did that particular study add? What did that researcher find that started to shift the paradigm of whatever it is you're studying forward? Then develop the review logically. Think about your literature review as you're developing an argument. So you wouldn't like start at the end and say, you know, this is what it is. You want to take someone on that journey. So what were the earliest ideas on that topic? How did they grow and evolve in the academic conversation? You want to start first things first. So the introduction, it gives a quick idea of the topic of the literature review, such as central theme or organizational pattern. The body contains your discussion of sources and is organized either chronologically, sometimes thematically. So if you're looking at something that's very qualitative, like mistreatments is a great example. So why do dialysis patients not show up for treatments on a consistent basis? There might actually be themes there. There wouldn't be like a chronological. It would be difficult to add a time, like longitudinal time to that, because it is very qualitative, specific reasons why patients miss treatments. So sometimes thematic, and then sometimes methodologically. So methodologically, we'll go into that in a little bit more detail, but if you were trying to figure out, like if you were going to test a technology, there might be a case where people have tested it and what method did they use to test it. And then conclusions and recommendations. Discuss what you have drawn from reviewing the literature so far. So what ideas has it given to you? And where might the discussion go from there? What gaps have you identified? And then including the references. As you're writing your literature review, you will mention the author's names, the publication, year in your text, but you also need to still compile the comprehensive citations for each entry at the end of your review and a reference list. Follow the appropriate citation guide, like I was saying. Most nursing-focused scientific journals use APA. Non-specific to nursing usually uses AMA. So formulating research questions. So we talked about doing a literature review because doing a literature review is going to help you really zero in on an appropriate research question for that topic. So just diving in and saying, here's my research question is often, it's going to create a lot more work for you because you start to do things out of sync. It also is going to help you have a lot of expertise on a particular topic. I had to do a presentation several years ago on infection prevention and dialysis, which at the time I didn't know a lot about. But then I spent all my time reading literature about, what had been published about reducing infections in dialysis. And I felt like an expert at the end of it, right? Like I knew so many things that all of the research that had been published on showering studies and collaboratives to reduce bloodstream infection occurrence, the CDC core interventions, I just learned so much in such a short period of time just by doing the literature review. So it helped me to define what a research question might be if I was going to investigate that topic further. So you spend enough time developing a good research question by doing that literature review. It's going to help you identify a high quality research question. It's going to help you look for knowledge gaps or areas of controversy. Do some people say, here's a great one. So when I'm talking about reducing bloodstream infections in dialysis, there's a huge controversy around core intervention number 9 that the CDC put out for reducing bloodstream infections, and that is the use of antimicrobial ointment on central venous catheters, so proactively, meaning that I'm going to apply this when I'm doing dressing changes so that essentially the patient would not get a bloodstream infection because I'm going to use that antimicrobial to kill off the bacteria that may enter the exit site when I'm doing this dressing change. So, but there's a lot of controversy about that because some catheters are not compatible. There's a whole list on the CDC website that you would need to make sure that your catheter was actually compatible with that particular ointment. And some patients have had not so great outcomes, and they often think it's because of the antimicrobial ointment. So it's a controversial area, just as an example. And then, are you interested, excited, convinced about your idea? So if you're not excited, it's going to be very hard to write about something in such a compelling way that someone who's reading that, a funder, or if it's going to get published, so it's going through an editorial process, they won't love it either. It will be obvious that it wasn't something you were necessarily interested in investigating. So the difference between a study hypothesis and the study purpose. So every study has a purpose, which might not be to deploy an intervention and see if it makes a change in practice. Sometimes it's just to look at a problem and describe it. So another example, I was doing my dissertation research. I wanted to understand how facility level factors, so dialysis facility level factors and patient characteristics that occur in the first 90 days of care, how that impacts a facility's performance on the standardized readmission ratio. So I was not deploying an intervention, not testing a hypothesis. I was just trying to understand if there were potential correlations there, and it was going to be hypothesis generating, meaning that if I found correlations, then I would say, oh, here's the intervention we need to go test because these things relate and we can do something about that. So there's the difference between the two. Every study does not require a hypothesis. Sometimes it's just to look at a problem and describe what it is. Sometimes that's also what qualitative research adds, is it helps us to look at a problem and collect a lot of qualitative data. I call free text data, where you actually say a lot about something, multiple people, you interview patients, you interview staff, and you get their perspectives on things, and it helps you to understand a problem that you might then go do an intervention to try and address that problem. So studies with a purpose, like I said, might be observational, descriptive, exploratory. Observational research is researchers observing the effect of a risk factor. So we know that diabetes and hypertension are huge contributors to end-stage renal disease. Let's just observe patients who have diabetes. Like, what is it that they do that potentially leads them to have more renal failure? A diagnostic treatment or test or another intervention. And then descriptive, a type of observational study that describes the patterns of disease occurrence. So again, with the diabetic example, like I might look geographically. Are more people getting diabetes in the north or the south? Describing how it occurs throughout the United States in relation to variables such as person, place, and time. Is it a particular age? That kind of thing. And it's often seen as a first step or initial inquiry into a topic, event, disease, or condition. And then exploratory, often used to investigate a problem that is not clearly defined, like COVID-19. So a great example in present day is we know some about COVID-19, but then there's a lot that we don't know. So doing an exploratory investigation of that, like looking at populations who have been diagnosed with COVID-19, like what is it about them? Where were they when they potentially contracted the virus? Were they social distancing? Did they use a mask? If not, nursing home settings are a great example to do an exploratory analysis there, because we know that that population has been heavily impacted by COVID-19, but there's a difference between the three of those. All of these allow for a first look, meaning that we don't quite have a hypothesis to test, but we might get there by doing this type of study. So how does a question lead to a hypothesis? This is where you begin to narrow your question. So a solid hypothesis makes predictions about relationships between variables. It's a cause and effect. Like in my dissertation study, I found that patients who do have pre-dialysis nephrology care, meaning that they're seen by a nephrologist at least for 6 months prior to actually initiating dialysis, their dialysis facilities perform better on the standardized readmission ratio. So there's something about patients who have access to care before their kidneys fail. They're followed by a nephrologist in that chronic kidney disease period as they progress through stages 1, 2, 3, and 4, and it does something, like they transition better to dialysis. And so if I was going to investigate that further, then I would say, is there a way to reach patients in that CKD progression to get them seen by a nephrologist so that they can transition better to dialysis? It should address at least part of a research question and is well grounded in existing literature and knowledge. Again, why that literature review is so important before really diving in. So how do you create a testable hypothesis? It's a tentative statement that proposes a possible explanation for some phenomenon or event. So a good hypothesis will have a strong rationale and address all or a portion of your research question. Here's the thing, it has to be measurable and reproducible outcome measure, have reproducible outcome measures. So it can't be something that is so abstract that nobody could ever replicate that. and it has to have some frame of measurement, because otherwise, how are you going to assess the problem that you're looking at? And what makes a good quality hypothesis? It makes a prediction that you don't have to agree with the prediction. So you could actually spend your research study trying to prove that wrong, like all patients in the South have diabetes. I don't know, that's just an example. But then you spin your hypothesis trying to prove that to be incorrect. And then it describes a relationship between an independent, which is the controlled variable, and a dependent variable, which is the measured outcome variable. So if I was going to try and do a study around incident patient care or pre-dialysis nephrology care, that could be something I could control, like I get it to patients or withhold it, which would probably not be something that I would do, but just giving an example. And a dependent measured outcome measures, I'm going to measure how the dialysis facility performs on a standardized readmission ratio. That's how I would set up independent and dependent variables to describe the relationship between those two. Controlling or providing access to more pre-dialysis nephrology care is going to make an impact on the dialysis facility's performance on the standardized readmission ratio. That's what my hypothesis would be. It is feasible for the scope of your project. So Rome wasn't built in a day. You can't put everything into one study and say that this hypothesis is all collective. It's going to solve this problem around, readmissions in the dialysis population. 30% of dialysis patients have readmissions, 37 very specifically. So I probably won't do one study and change care coordination in America. That's probably not going to happen, but it would be the first step. And then that's how you build a trajectory of research, where you take this first study, you do this thing, you learn from it, then it takes you to the next thing, and it takes you to the next thing, and you just keep going until you look back and say, wow, we've really made a difference here in care coordination for the end-stage renal disease population. So developing research aims, a hypothesis to specific aims. So we go from developing the hypothesis, now we're going to say this particular study has these aims. So once you have a good hypothesis, you're going to brainstorm ways to test it. How are you going to test your hypothesis? So most hypotheses can be addressed in different ways. So I would not say take what comes up first and run with that. Really think about it and create a list so that you can say these are relevant to this particular study. And you may save that list and say, okay, in the next study we'll look at these next few things. So considerations for constructing aims. You want to know what your assumptions are. Assumptions are the way that you look at the world. It's things that you don't even know that you actually believe. So they're unexamined beliefs, like trying to think of an example, and maybe one will come to me, but what we think about the world without realizing we think it. So another kind of relevant example in today's society is we've been talking about systemic racism, meaning that it is so ingrained that it's hard for us, like the system, even if we changed variables that made things easier for our African American colleagues, they would still be at a disadvantage. Like, it's so ingrained at this point. But a lot of people don't see that. You don't see it as a belief that is systemic, that it is so ingrained that it would be hard to just change it in one day. So assumptions can be incorrect or misguided. So you can start to create a research program that is built on assumptions and it's not really rooted in science, which is why doing a literature review is so important, because you will learn things you didn't know, or that you'll start to see where your biases are. So you can say, oh, I really thought X, but that was just my experience. Here's the other thing too, is like, especially if you're still on the front line in practice, you kind of see the world or see nephrology or see dialysis from what is presented to you every day in your patient population. Then you may go to another geographic area and you would see it totally different, because that patient population is so different. So, that there are patients who get end-stage renal disease and it has nothing to do with diabetes and hypertension. There are congenital abnormalities that occur, or cancer, of course, can cause certain kinds of renal failure, or acute kidney injury from an accident that leads to end-stage renal disease. All of these things, but the way that you see it in practice might make you believe something very specific that's not all-encompassing. So also know the limitations of your measurements and consider possible controls. So a standard of comparison for checking the results of an experiment. If you're going to do an interventional study, it's always the best idea to have some form of control, where you compare the population you're deploying the intervention on to a population that's not receiving the intervention. And then confounding variables can lead you astray. So these are what we call extra variables that you didn't necessarily think about. So for example, if I was going to study, like truly study the standardized readmission ratio in dialysis facilities, how do readmissions occur in dialysis facilities, how they're attributed, all of those things, I really need to think very critically about variables that would impact that. So for example, access to care pre-dialysis, so patients who are still, before they're diagnosed with end-stage renal disease, if access to care, that is a confounding variable that I would need to consider if I'm going to look at the performance on the standardized readmission ratio. So they can affect your dependent variables, the thing that you're going to try and provide to patients, the intervention that you're deploying, could be impacted by this other variable that you hadn't thought about previously. So specific aims, they are the roadmap for the project. They are essentially, when you write your specific aims, you're going to write your analyses to address those specific aims. Like if I was going to describe end-stage renal disease in Virginia, then I would do a descriptive statistic analysis of those characteristics, of particular characteristics of end-stage renal disease in Virginia. And it would, that would be a table in my manuscript. So just give an example of how those two things connect. If you're going to measure it, it should be addressed in the aims. If you measure it, have a plan to use it. So sometimes that you can collect data that's going to inform your next study, but it would still need to be addressed in your aims. If you have an interesting idea that is not directly being tested and your hypothesis, save it for later. So like the next study you're going to do, but it's a great way to build a research program. So how do you develop specific aims? You kind of start with the end in mind. So if you're looking at where you want to go, work backwards from there. The specific aim should be directly linked to the hypothesis. Each aim should be highly focused. So if you start to use the word "and" when you're building specific aims, then that probably needs to be another aim. So move it down to the second line, and that's your second aim. And then consider your feasibility. So time, resources, statistical power. If you're going to do an interventional study, you would need to look at how many subjects you would need in your sample size in order to have enough power to say the findings that you found are actually statistically relevant. So you have to consider that on the front end. Time and resources are a big deal too. The study, it could last 5 years, but sometimes you need shorter periods of time, studies that last shorter periods of time, so that you can keep looking at a specific problem in different ways rather than being tied up on one study for a long period of time. And then putting it all together. So take the research question, you identify what the purpose or hypothesis is going to be for that study. Then you build out your specific aims, what is measured, how it is measured, what are the controls, and how you interpret your data. Here are the references used for this particular module. And this concludes module 1 for the research modules provided by ANNA Research Committee.